So, good morning. I'm Heli Laarmann. I'm from Estonia and I'm working as project manager in Estonian eHealth Foundation. And I will talk to you about lessons learned on patients' access to their health data. And as Penny said, then this is our experience from this project. First, some facts about Estonia. Estonia is a tiny country, and the area of Estonia is only around 45,000 square kilometers. Population is also quite small, 1.29 million inhabitants, but we have 60 hospitals and 464 GPs. The core element of funding our healthcare system is solidarity-based mandatory health insurance contribution, but the healthcare expenditures is actually quite small. In 2011, it was only 5.9% of GDP. The next year it rose a little bit, but it's still quite tiny if we are comparing on the level of EU. About our organization, Estonian eHealth Foundation is the organization which is responsible for developing and also promoting e-health services on national level. The organization is quite, let's say, not new, but it's not very old because it was founded in 2005 and it was founded by different stakeholders in the healthcare sector. On strategical level, our organization is managed by Estonian eHealth Foundation Board, and everyday work is managed by Management Board. And everyday work is actually run only by 4 different departments. One is responsible for standards. Then there is a department responsible for services, IT and communication. And we have also so-called medical advisory board just to support with very specific knowledges on healthcare. How it actually runs in Estonia? With a very simple word, it is so that all healthcare providers they are obliged to send medical documents, electronic medical documents to the Central Health Information System, which is managed by our organization. But they can also request these medical documents from the Central Health Information System. And for today, we have actually 13 million medical documents already stored there and can be requested by healthcare providers. And there are 17 different types of these medical documents. From the same Central Health Information System, also patients can access this data. And for today, we have 1.3 million persons already who could find medical information, electronic medical documents from our central system. I think that this number is quite good. And this central information system is also interacting with different Estonian e-services we have. And this interaction is actually possible thanks to our X-Road, which is so-called backbone of e-services in Estonia. It's a secure environment which allows to request and send electronic data. It's with very simple words, if I'm trying to explain it so. Now about the patients. The usage of these eHealth services which we are providing, the usage is growing, it's clear. Just for example, when we are looking the average requests from patient portal per month, then just looking, for example, in 2012 and 2014, these numbers, the numbers has increased almost 3 times, and it's quite good increase, I would say. What kind of services we are providing to patients on the national level? The list is quite good, I would say. First, we have several medical documents. I don't go into details here, but these several medical documents, as I said, are sent by healthcare providers. But starting from June this year, now our patients can also fill in a health declaration. At the moment it's still on a pilot phase, but it seems to run quite good. Then we have links to medical images. It means that patients can see from where they can find these pictures, images, but they cannot see directly these images. This is the difference. So then we have e-prescriptions, and these e-prescriptions can be seen now also by the patient portal since June again this year. Then they can find emergency data. It's important in case of some kind of accidents. For example, it means that there are information about allergies, chronic diseases, and so on, what could be life-threatening in certain cases. Then information about health insurance validity. Then book a consultation. Expression of wills. There are different types of expression of wills. And these should be also signed digitally, but can be changed again if someone would like to change their will. Then delegation of access. It means that patients can give access to someone else if they want that someone would see their data, or even to manage their data. Then masking data. It means that you can close a document, and closing or masking, it means that this document cannot be seen anymore. And then tracking usage of data. It means that each action in our database will leave a clear sign, a track, and it can be seen. If someone has just requested your data or whatever. So this is what makes the system very transparent for the patients. Now to the sustains services which are available. In sustains we grouped the services into 4 different types. And my presentation will be about 2 types of sustained services. One is about managing one's EHR online, and the other one, the type is online access to health and healthcare information. And my good colleague from Finland will talk about 2 other types in the next presentation. As the time is quite limited today, then I cannot cover all these services, but I will concentrate on 2 services. In the first block, I'm talking about masking sensitive data, and in the other block of services, I'm talking about tracking referrals. I can say also why I choose this one. I think that these 2 are the most intriguing. There are so many ethical issues, there are so many different opinions, there are so many different solutions. And I think that for the moment there is no right answer how it should be solved or what is the right way to solve it in the future. In all cases, when a patient would like to see the sustained services, they should first log in to the patient portal. They can do it by mobile ID or ID card. Masking sensitive data. The data can be masked to healthcare providers, but also to trustees. In case of healthcare providers, patients can mask document by document, or there is another option, they can close all documents just by one click, and they have to, this is the view what they can see, and for closing all medical data, they have to just click here. Just one moment. They have to click here. And after clicking on that, this red button, this green button here will be red. It shows that, and there is written that it's closed now. And also this button will go red, so the patient can see. So two possibilities. Just clicking on this one button and closing all documents, or clicking on one concrete document here and closing one document. 2 possibilities. For trustees, they cannot close all documents by one click, but document by document. Just a view. How does it look it later? Then summary about masking sensitive data. Data can be masked and opened again to healthcare providers and trustees. In our case, we have solved it so that masking sensitive data does not require digital signing. You just click the button. But there is quite a lot of discussions around it, because people tend to think that maybe it's too easy. Because when you are thinking about this, what is coming out when you are closing a document, it means that actually the healthcare provider does not have the whole picture of your health data, and maybe the treatment is not so good or is not the proper one. So should it be so easy to close data or not? This is the question. The others are saying, why we have to make everything so complicated? Let them click and open again. Don't ask all the time all kind of security issues and signing and so on. Because person is already not signed in, but gave in the PIN code, and the identity of this person is clear, and this is what he or she would like to do it at that moment. let it do it then. So there are different opinions about it. One important aspect about sensitive data and closing data is also data can be masked only by adults. It means that there is no possibility for 10 years person to go in and mask the data. There is another option more, and it's about the possibility for healthcare providers to mask documents for 6 months before making it possible for patients to request the document via the patient portal. Why? Because in certain cases, for example, if there will be a diagnosis, for example, cancer, is it okay when a person is logging in and seeing a document, I have a cancer now? Maybe she is alone at home, having no information. Is it okay? This is the question. How many persons have used this possibility to mask sensitive data in case of Estonia? For closing all documents, there are only 810 persons who has closed these documents, all documents. And also the numbers of those persons who have closed the documents for healthcare providers to trustees is not so high. But still, people would like to use that kind of services. And it's, again, important to remember. Now, tracking referrals. It's quite simple for the patients. They have to just click on this yellow box down there, and then they can choose the time period when they would like to see who has checked their data or made a request about their data. And then there will be a list of all these requests made about their data. It's quite simple. By law, patients have rights to know what kind of data has been collected about them in Estonia, and also who and why has been used their data. Via this tracking referrals sustained service, we are actually providing to patients secure way how to see who has requested their data. And if a patient will see that someone has requested data without having a proper reason for that, then they can submit a complaint to Estonian Data Protection Inspectorate or Ministry of Social Affairs. And also healthcare providers should have internal regulations to guarantee that the patient data is used only if it is grounded. And they should be able also to provide information to patients who and why has seen their medical documents. What is good is that patients are actually using these services. And I can say it based on the feedback and information patients are asking from our help desk. And also it is good that misuse of data from Central Health Information System is rather exceptional. and there is the number of complaints is not high. And the last point I would like to point out is that there is a specific issues about dynamic data. I will not go into detail of it because the time is pressing on. But what I was thinking here is that at the moment, tracking referrals is providing only a possibility to see who, when, and what kind of documents have requested. But it doesn't show what is the content of this information on that moment when the request was made. But in time of dynamic data, if you are knowing that a person has looked your, let's say, health declaration information, for example, then later this information will be changed and you don't know what kind of information during this request time was possible to see it. Maybe it's complicated what I'm trying to say, but when the data are exchanging and are renewed during the time, then you don't see what kind of information during the requesting the data was possible to see. Okay, this is all. Thank you.